Hi, everybody. It's Dr. Jennifer Ashton. I'm going to give people a couple more minutes to make sure that everything is working and everyone's signed on. But I want to welcome everyone to this great webinar. For those of you who've never participated in a webinar, I think it's a super easy, fun, and interesting way to get information and to communicate with other people who may be across the country, or they may be across the world, actually. So I want everyone to know that as you listen to the information that I'm about to share with you and look at the PowerPoint slides, there will be plenty of time at the end to share comments, questions. You can do these verbally by raising your hand on your console control panel. And then I'll unmute you and your voice will be heard. So if you want to give yourself an assumed name, that's fine. Otherwise, you'll be anonymous by voice. And if you want to write your question, you can do that also. There's a section for that under chat on your control panel, and then I can just read your question and answer it to the group. So that's kind of the basics. There's no right or wrong question. There's no right or wrong comment. So I want everyone to feel really, really comfortable, asking whatever comes to mind. And I hope everyone learns a lot. And if you know someone who wanted to participate with tonight's webinar and couldn't, we will be recording it so we can share it via email, or you can just tell them about it, because hopefully by the end you'll be a little bit of an expert yourself. So you should be seeing on your screen now, this is the agenda of what we're going to be talking about tonight. We're talking about a relatively new procedure called ThermiVa. It's been covered pretty extensively already in the news and in the media, so we're going to talk a little bit about that and what you may have seen already. We're going to be going through one of my favorite parts, which is the patient testimonials. I think no one is better at describing their experience with this procedure than women who have had it themselves. So that's my favorite part. Indications as to what type of patient should or would consider ThermiVa as an option. We'll be talking about that. The science of ThermiVa, what it is, how it works, really what's going on, so that there's no mystery there. I think that's pretty cool. As a science medical geek, I'm into that part of it. The before and after photos, I will tell you, are absolutely jaw-dropping. There's that saying, a picture is worth 1,000 words. I think these pictures literally say it all. So I think that to me is one of the most compelling aspects of the webinar presentation. What to expect, I'm gonna take you through the procedure literally. You'll have a visual animation of how it's performed, and we'll kind of talk through literally what goes on, in my office setting or in an office setting before, during, and after the procedure. And then, as I said, there'll be plenty of time at the end for Q&A. So you should be looking at now a great screen of part of the media coverage that this procedure, ThermiVa, has gotten recently. It's been covered extensively in all national print media, as well as online sites. And dead center, of course, you'll see a picture of me on air at Good Morning America with my friend and colleague, Amy Robach. For those of you who don't know me, I am really, really blessed and privileged to have an incredible career helping women in all aspects of their health and wellness. So unlike many doctors on television, I have a full-time GYN practice that I started myself 8 years ago. Some of you who might be on the webinar have actually been to my medical office here in Englewood, New Jersey, and so you know that I put literally my heart and soul into creating a very unique practice experience for my patients and for women who come to my office. If you've been here, you know that I have a very elite and dedicated staff. Carol, who's my practice administrator, is usually the first person that my patients interact with when they pick up the phone or send an email to us. And then Anna is my medical assistant, who is helping me actually deliver the actual patient care in my practice, and in the exams and procedures that we do. Anna, Carol, and I have been working together for a total of 12 years, and I can tell you that they absolutely share my commitment and dedication to my patients, and we feel that we deliver literally unparalleled care to women and girls who come to my practice. In addition to what I do in my practice, I am really fortunate and proud to say that I have 2 national television titles. For Good Morning America and ABC News, I'm the chief women's health correspondent. I've been doing that for 4.5 years, and been delivering medical news in national television for 10 years. And as of this year, I have been appointed the first ever chief women's health contributor to the Dr. Oz Show. So between those 2 platforms of news and daytime television, I'm doing on national television exactly what I'm doing in my office, which is delivering really important medical, lifestyle, wellness, and nutritional information to women across the country. And all said, reach about 5 to 6 million viewers in my television platform each time I'm on the air. So I did take advantage of the opportunity to mention ThermiVa on Good Morning America. This was a segment that I did recently in which we were talking about all of the new advances and treatment options for women who are breast cancer survivors. And so ThermiVa is definitely a new option for women who have been treated for really any type of cancer with chemotherapy or radiation therapy, who may have suffered premature menopause and therefore vaginal dryness and all of the kind of functional issues that come along with menopause. So that was the context in the segment. And I should mention that ThermiVa was one of many options that I mentioned in that segment, so I will be hitting those during the course of this discussion as well. This is some of the ThermiVa coverage that has been in print media. I have a monthly column in Cosmopolitan magazine that I've been doing for the last couple of years called Ask Dr. Ashton. I think I look like Kelly Ripa in that picture, but it is me. Again, I mentioned ThermiVa this time for premenopausal women. So even women in their 30s or even potentially late 20s or 40s. This is just premenopausal women who are having an issue with vaginal dryness. Sometimes this can happen from being on a birth control pill. Sometimes it can happen postpartum after delivery. It's actually a low estrogen state for women. And sometimes it's because of other medications that a woman might be on. And so ideally, the treatment would be to figure out what's causing the vaginal dryness, but sometimes that's not always possible. So ThermiVa is an option for those women. But you can see it's been covered in Goop, which is Gwyneth Paltrow's site, and it's really getting tremendous coverage in print media, which is really, really exciting. And as you see, New Beauty magazines, the reason everyone is talking about vagina these days, and for me as a gynecologist, anytime we can talk more openly about what I really consider to be the portal to a woman's wellness, her vagina, I think that's a good thing. This is one of my favorite sites. So we're getting to the patient testimonials section. This is a site you can all go to after the webinar. It's called realself.com, and it basically is real patient testimonials for any possible procedure you can think of. So you can see on that page hysterectomy. They have a lot about ThermiVa, but I mean, I have spent what seems like hours. I would love to spend hours reading these comments because I love hearing from real women and the experiences they've had. But, you know, they have everything on there from liposuction to skin tightening to Invisalign for crooked teeth. But I think the ThermiVa reviews are absolutely compelling. They'll give it a thumbs up or thumbs down. They'll give their various locations. Sometimes they mention the doctor who performed the procedure. But most of all, they're going to share with you why they had it done, what the experience was like for them, and the effects or changes that they noticed afterwards. And I can't imagine any procedure doing as well on this rating scale. 98% rating it worthwhile, and that's over the last 2-year period. So I think that's pretty impressive. So what actually motivates a woman to consider this procedure? These are the common patient concerns that I hear about on a daily basis in my office, and some of you listening might be experiencing some, or in some cases, all of these issues to some degree yourself. They are mostly associated with a drop in estrogen in the lower genital tract. And again, whether that happens after cancer treatment, whether that happens as a result of being on the pill or just having a baby, or just going through menopause, the results are generally pretty unpleasant for women from that lack of estrogen. It causes what we call in gynecology vulvovaginal atrophy. So if you imagine your bicep as a muscle and it atrophies, you know what it's going to look like. Basically, on a cellular level, the same thing happens to the vagina when we go through one of those low estrogen states. So it gets very dry. It stops making its own natural lubrication. So you may have heard I love this statement that the vagina is a self-cleaning oven. Well, it stops cleaning with this state. So that loss of lubrication really, really dries everything out. As a result, just because of basic anatomy, urinary problems or issues are really, really common. So this could be a little loss of urine that occurs with a valsalva or strain, meaning laughing, coughing, sneezing, jumping. Some women lose a little urine when they're having sex. I see women not infrequently who say they have to actually wear a pad because it happens so often. This is a major quality of life issue for women that are otherwise very vital and vibrant. The laxity factor could be internal or it could be external. And I'm going to explain, I think more of that will become clear when you get to see the before and after pictures. Laxity, talk about the bicep analogy. As we age, it seems like laxity is happening to our whole body. But just as you may be familiar with that phenomenon in the face, as we lose collagen in the face and tissue starts to sag or drop, guess what? The same thing happens, the external genitalia and the pelvic floor in general. So laxity, again, is not going to be great for sexual function, and it's not going to be great for bladder function. Pelvic prolapse is something else that is pretty variable. This can be seen in a very young woman after the birth of a baby, or it can be seen after menopause, but it's basically a collapse of those internal pelvic structures that support the vagina, the bladder, and the rectum, causing that feeling like things are hanging out. And ThermiVa has been shown to actually be able to give some resolution to that, which is really exciting. That's something that normally the only option really is major surgery. And then orgasmic disorders. These, if you imagine having any of the aforementioned issues, you can imagine maybe it's not going to be so easy to have an orgasm. So this is something that I hear from a lot of women, you know, and they think something is wrong with them. And in some cases, this causes major problems in their relationship and their self-esteem. So whenever we propose a treatment or a procedure in medicine and surgery, you always have to ask, who's the ideal candidate for this? So as I've mentioned already, when you talk about the range of women who are ideal candidates for ThermiVa treatment, look at this list. There are so many women with so many functional issues that I think should consider ThermiVa as an option. This could be peri and menopausal women just with vaginal dryness, loss of lubrication. And when we talk, by the way, about dryness and loss of lubrication, that goes hand in hand with very painful intercourse. The vagina literally can scar down and become almost impossible to accommodate even one finger, let alone anything larger than a finger. And the typical GYN medical answer to that was use a lubricant and hope for the best. So what happens when you use a lubricant? This is the analogy I want you all to think about. Think about an ice storm on top of a cracked driveway, because that's really what's happening when you go for an over-the-counter lubricant, which is that it's making the surface tissue very slippery, but it still feels like you're tearing and burning when you try to have sex because the driveway is still cracked. That's on a cellular tissue level. So lubing up the surface does not help that. Topical estrogen cream absolutely can restore some of that vitality to that tissue, but that's something that is definitely an option for a lot of women, and I have a lot of patients who find that sufficient, but it doesn't always do the trick for everyone, and a lot of women don't want to use estrogen cream vaginally, and they find it messy, and of course there's an ongoing expense with that as well. So I always include that as an option, but for some women it's just not enough. And by the way, before we leave the issue of dryness and loss of lubrication, I just want everyone who's listening right now to know that while the over-the-counter lubricants, they probably feel great for the man, but I really actively discourage my patients and women from using them, because most of them, if you turn the box around and you read the ingredients, have chemicals, a lot of them based with propylene glycol, which is basically the same chemical derivative used in antifreeze. So if you thought your vagina was dry before, try putting a whole bunch of chemicals on it and see what happens after that. So I usually recommend something natural like sunflower oil or coconut oil, actually, or topical estrogen cream or ThermiVa. So those are the basic kind of options for vaginal dryness. Women with stress incontinence, we talked about. Post-cancer, we talked about. I think this is literally going to be a game changer for women who are cancer survivors, who literally can't take any kind of hormonal therapy, and so they feel like they beat the cancer, and now what is their quality of life, because their vagina is basically non-functional. And again, sexual intimacy problems, incontinence. I think everything on this list is really an appropriate candidate for consideration for ThermiVa. So we talked about losing some urine when you cough or laugh. That's something that I will tell you already. I've had ThermiVa for about 6 months now. The success stories or patient satisfaction for what we call overactive bladder symptoms with this treatment are absolutely unbelievable. My favorite patient that I talk about is in her mid-40s. She is not perimenopausal yet by symptoms. She's had 4 babies vaginally, and every single time she sneezed, she lost urine. I did 1 treatment on her so far on a Thursday. By Saturday, the loss of urine was completely gone. And she just couldn't wait to tell me, and she actually brought me a bottle of wine when she told me about that, which just made me so happy. I mean, talk about life-changing. She's really said she can't even remember what it's been like to sneeze and not lose urine. So some of these questions you can ask yourself. Do you occasionally leak when you sneeze, cough, or exercise? This happens to 25 million Americans, and of course, most of them are women. Do you feel dry during intercourse? a third of perimenopausal women and 50% of menopausal women are impacted by this. And I just want to say, you know, that a lot of us struggle with aging as it is, but you know, right now there's a statistic that I want everyone listening to be aware of because I think it's really cause for celebration, which is that if you reach the age of 65 without cancer or heart disease, as a woman right now in the United States, your life expectancy is 88 years of age or more. So if you're in your 40s, or let's say you're 50, you're barely at the halfway point of your life. And I think that using your vagina is a big part of the second half of your life. So when you look at a statistic like feeling dry during intercourse, I think that we really need to consider where we are in our lifespan and how we want to see the rest of our life playing out. And then again, sexual dysfunction, orgasmic problems, this affects nearly 1 in 3 women. Men have Viagra. The pink pill for women is not really that effective because a lot of the issues that a woman has perimenopausally and postmenopausally, these are really functional. And if we can make a dent in this type of sexual dysfunction, that's a huge victory in my opinion. Okay, so here's a little bit about the technology. Here's that comes the geeky science part. This is what the wand looks like. These are disposable single-use applicators. So this is part of the reason for the cost of the procedure is that these are not being sterilized person to person. They're not being reused. Although I will say that when we got the device in my office, myself, Carol, and Anna each wanted our own wand. We wanted to put it on the shelf and save it for our use. We haven't done that yet. But they are single use. They are sleek and ergonomically designed. And as you can see with the picture there, they are about the same width as your index finger. So this is not an uncomfortable applicator at all. Our treatment range temperature-wise maxes out at 47 degrees Celsius. So this is something that in terms of the internal treatment is barely noticed as anything that a woman feels. I mean, a lot of women are texting, talking on their phones. When Anna and I went out to California to get to the training center to get trained in the procedure, the patients I did out there, some of them were literally on their laptops. Some women will feel a warmth, mild warmth. If it gets uncomfortable, i.e. too hot, we turn down the temperature. So it instantaneously goes down. How does this work? This is pretty cool. As you can see with the yellow arrow, it really comes down to this procedure using a temperature-controlled radio frequency energy basically stimulates new collagen production. This actually originated from the aesthetic dermatology and cosmetic dermatology world. So any of you who have had any kind of facial treatment at your dermatologist to stimulate collagen, it is possible that it uses a similar technology or the same exact technology. When I first heard about ThermiVa and researched what this technology was, how the treatment worked, once I saw that it was temperature controlled RF, radio frequency, I knew for a fact that it would work in the vagina because I know what it's done on the face. So it heats the skin and the vaginal mucosa and actually stimulates and promotes 3 different types of collagen formation and collagen effects. One is the immediate contraction of collagen. Now, if you're listening and you think, but I think my vagina is already scarred down and tight, it's not going to be tighter. It treats laxity by making the vagina feel more snug, but actually that immediate contraction of collagen is revitalizing the tissue. So it's a little counterintuitive in terms of, you know, you hear contraction and treating vaginal laxity, but I can just tell you that if your vagina is scarred down from a lack of estrogen or postmenopausally, this will eventually, because of the collagen formation, actually make it more elastic, which is what the second bullet point says, increasing elasticity, and that happens immediately. And then long term, it is stimulating the production of new collagen. Thermal neurogenesis is the geeky scientific term. You can see there's two diagrams or schematics of cross-section of vaginal mucosa and how lubrication occurs. So I think this slide is really, really informative. And ThermiVa is literally increasing blood flow and restoring the nerve signaling that then turns on that normal, natural vaginal lubrication. So the description that's used in terms of the lubrication effect is that women go from having a vagina that's as dry as the Sahara Desert to having a vagina that's like the Amazon rainforest. And this is absolutely what I've heard from my patients, which is pretty amazing. So you're going to watch a very brief animation of the procedure now. And this will give you, I think, a really good idea what to expect. Those numbers on the applicator are so we can measure the actual depth of the vaginal canal. Everyone's vagina is slightly different length. We don't go all the way to the cervix, but we do measure the entire vaginal canal. And then the treatment area internally is based on quadrants. It's usually about 18 minutes. And as you can see in cross-section, it goes almost the full depth of the vaginal canal. And in front is the bladder and the urethra, and the back is the rectum. We don't go in there. So I think that that's pretty interesting. Here's what you can expect clinically with this procedure. Number one, obviously this is non-surgical, so you need no anesthesia, no sedation, there's no downtime. It's literally an office procedure. We're talking and chit-chatting throughout the entire time. There are 3 sessions required 1 month apart. Now, why are they 1 month apart? Well, anyone who's done anything for their hair or their teeth or their face knows that sometimes there are natural processes or life cycle of the hair follicle, if you're talking about hair growth, that needs to occur, and those things take time. So again, it's like having laser hair removal. It doesn't all disappear after one treatment. This is very similar. I'm often asked, what if I can't come exactly 1 month apart? Not a problem. You can come 5 weeks, you can come 6 weeks. The ideal interval is a month, but obviously there's a lot of variability in that. When we say no downtime, literally women can have sex that same day. And the vast majority of women are noticing significant improvement after the first or second session. Now, this is going to vary person to person. And it's also really important, if you're listening, to put your own symptoms kind of on a scale and understand that, let's say you're unable to have sex at all right now, so your symptom score would be 100% or a 10 out of 10. You know, you might get down to a 2 out of 10 in severity with this procedure, but that might be enough. I mean, that's pretty impressive. So I always tell women that the individual results vary, but many, many women have a very significant improvement after the first or second session. And how long does it last? Again, it varies. 9 months on the short end, 1.5 years on the long end, at which time usually we say 1 touch-up session is needed. Okay, some pictures. So I look at female anatomy all day, every day, but a lot of people don't. This is not my patient, but these are women who have had the procedure done. If I had to guess how old this woman was, you know, she could be in her late 40s or she could be in her early 60s or anything in between. And you can see on the right, this is an immediate effect. So this is literally a before and after the first procedure. The patients that we've done in my practice externally, Anna and I have literally seen this happen before our eyes. It's like watching magic. You see an immediate contraction or tightening of that lax tissue. This one, very similar. This is an immediate effect. This doesn't even look like the same person, really. So you can imagine, if this is what's happening externally, what's happening internally. This is after 3 treatments. And again, this patient had the labia minora, which is the inner lips that are not hair covered, as well as the external vulva. And I just want to say, in terms of the external treatment, we always offer that to every woman who is having an internal treatment, but this is a very personal decision. There's no right or wrong answer on this, whether you should or shouldn't do it. This is based on your personal opinion of your aesthetic interpretation of what you look like. And some women don't care and other women do. And, it's not dissimilar from having a laser treatment on your face or fixing your nose or anything. So there is no functional issue externally, but certainly a lot of women want that skin kind of tightened up for whatever reason, and they're really happy with the results. Again, this is another one that you can see progression over time. This doesn't even look like the same person when you look at this over 3 months, and you can really, really see the difference there. It's pretty impressive. So, in closing, I would just want to say, this is something that when I first learned about this procedure, which is about a year ago, it was through my role in television, and that's actually enabled me to stay cutting edge in a lot of health and medical advances that not only affect us all in the country, but affect my patients in my practice. So it's given me really an opportunity to stay on the forefront of science and medicine and technology in a way that a lot of physicians who don't have a media role are unable to do, because they'd be waiting to read the article in Cosmopolitan or hear about it on the news, and I'm kind of getting it well in advance of that. So when I heard about this, I was very curious, and when I learned about the technology and how it started from the world of kind of cosmetic dermatology, I knew for a fact that it would work. When I went out to the training center in California and actually saw the clinical data, I was just blown away. And I literally think that in just the year and a half that this procedure has been available in this country, and now it is spreading worldwide to the Middle East, South America, Australia. I mean, it is literally spreading around the world. I think, and I encourage every woman for any procedure to always ask these questions. What is the risk? What is the benefit? And there are very few things that offer the positive clinical impact with the minimal to no risk or downside. Those things just don't exist. If you take an aspirin, you might get a great benefit, but you could get internal bleeding. So you always have to balance risk versus benefit. I look forward to the day when this is covered by insurance. That would be wonderful, but we should actually just start with insurance covering birth control. Let's not be greedy. They don't cover birth control yet, so I'm not surprised that this isn't being covered. But I look forward to that day, because I think that this is going to be a game changer for women. And I think there is very, very little reason not to do it, if any. I think the significant positive impact is potentially life-changing for a lot of women. So I'm thrilled to be one of the first gynecologists in the tri-state area to have it. And I know my patients have been really, really thrilled with the results. And so we can take any questions now. I hope you guys found that helpful and learned a lot. Okay, so we have one question. One question is, why a typical OBGYN is against any temporary fix, such as this procedure? If I'm understanding that question correctly, I think that the answer is that a lot of OBGYNs, and this isn't necessarily a bad thing, but most doctors are trained to have to see the data and the evidence written in a journal, a medical journal. And to do that takes hundreds of thousands of patients and millions of dollars to do those studies, and then it has to be published. And in the field of women's health, unfortunately, I find that there is a lot of bias against advances that, if they were for a man, in my opinion, they would be approved or fast-tracked. But for women, they are second-guessed and judged, and for that reason are really, really slow to be generally accepted. I think another reason that a typical OBGYN could be against something like this, or skeptical or cynical, is just lack of education. As I said, it's only about 1.5 years old for this type of indication in this country, but obviously been used for the face for a long time. And I think that people in medicine and in science can be skeptical of something that they don't know about. So I guess that's the answer, if that makes sense. Second question is having this procedure safer in the long run versus long-term treatment of a medication such as Vagifem? That's a great question. So Vagifem is a type of estrogen, and estrogen vaginally, I think, is a great and important option for a lot of women suffering from a lot of these functional issues. The data has shown that estrogen is not absorbed throughout the entire body. So there are even some oncologists or cancer specialists who will allow their patients who are breast cancer survivors to use vaginal estrogen, but a lot of women and doctors are afraid of that. So for some of them, they don't want any hormones in their body, period. In terms of safety, as I said, there really isn't any medical risk to this procedure. I always say the only real risk is that you're expecting an incredible result that you don't get, and I don't think that's a very likely risk. So I don't think that you would say that one is necessarily safer than the other. They're just different options in terms of therapy. Long term, any vaginal estrogen treatment is indefinite. It's not a short-term thing, it's long-term. Next question is, what is the risk of burning? What are all the risks? So there's really no risk of burning because we have one person at the console controlling the temperature, and then who is ever performing the procedure, and in my practice, I perform it. I guess there are some practices that non-physicians can perform it, but I'm a little too much of a control freak to do that. But I'm performing the procedure, and Anna, my medical assistant, is at the console, and the second someone feels too much warmth, we immediately pause the device and turn down the temperature. The vaginal area, the vaginal mucosa, really, the risk of burning, I think, is, I've never read a case report of a vaginal burn with this procedure. But again, that's why we're constantly watching the temperature number on the console. And then all the risks, as I said, that's it. I mean, I wouldn't say this is a risk, but something that I've noticed that happens in some postmenopausal patients, that there can be some bleeding or spotting during the procedure, which again is because we're going back and forth for 18 minutes in the vagina. So any woman who has any spotting or bleeding with intercourse could expect some spotting or bleeding with the procedure, but usually that goes away after the first procedure. Next question, since it's so new, how do we know about the long-term risks? That's a very important question. In terms of stimulating collagen or increasing blood flow, we don't know 10 years of data, 20 years of data on this, obviously. There are a lot of things in medicine that we don't know 10, 20, 30 years of data on, most of which I'm sure you've heard about in the news. And sometimes that's okay. And sometimes, we're, as I always say on television, we're always reinvestigating, reassessing, and reanalyzing even things that are 40 and 50 years old. The only kind of common sense contraindication, I would say, or reason a woman should not have this procedure would be if she has a known precancer or cancer of the cervix or vagina. Then obviously just I wouldn't think it would be smart to do this. But in terms of stimulating collagen, you're restoring what was there before the estrogen depleted from those tissues. We have someone wants to actually ask a verbal question, which is great. Okay, go ahead. Andrea, go ahead. You had a question.
I just wanted to know the pricing structure of this.
So the price is going to vary based on where you are across the country. In my practice, we set the price at about $1,300 a procedure. And again, 3 procedures are needed, and then 1 touch-up probably per year. The price range varies throughout the country. There are some people who charge $2,500 per procedure. The lowest, I believe, is probably $1,200. So this is something that I hope in a few years it becomes like the flat screen TV analogy, where it used to be $20,000 to have a great flat screen TV, and now it's just $200. But right now, this is a $90,000 machine with very expensive applicators that are not reusable.
Great, thank you. Can I come in? Can I come in tomorrow? Sign me up.
Right, we're open right now. Thanks, Andrea.
Thank you.
Okay, so next question. So follow-up question, if I have the procedure, would I need to continue on Vagifem or vaginal estrogen? So that's a great question. Usually this is what I am telling my patients who are already using vaginal estrogen. I will usually tell them to stop using it during the 3 months that they're undergoing the ThermiVa. Why is that? Because I always like to know the results you're getting. Is it only from the ThermiVa, or is it from the vaginal estrogen, or is it from the 2 together? There's no downside to using the Vagifem or vaginal estrogen with the ThermiVa, but I feel so confident about the results I've seen and the technology with this treatment that I like women to see for themselves without any estrogen exactly what's happening. And I have to share a really, really amazing text that I got from one of my patients on whom I did 3 treatments. And she is maybe just in her early 50s, just kind of postmenopausal, has a really active and I think pretty satisfying sex life, and was feeling a little vaginal laxity, a little vaginal dryness, and that was basically it. So after the first treatment, noticed like Amazon rainforest, natural lubrication, like extreme. After the and then I said, any change in sexual sensation or feelings with your orgasm? Not yet. After the second one, she said that the sensations she had during sex and her feelings and her orgasm was more intense, and it felt maybe a little bit snugger vaginally. After the third treatment, I get a text from her, and she said, I have something to tell you, and it's a little pornographic. And I said, listen, I'm a gynecologist. I've heard it all. There's no such thing. Just go for it. And she said, I just squirted for the first time. And I said, I'm sorry, what? And she said, I didn't think it was possible, but it happened. And she said this was an OMG, oh my God, orgasm that she would have never, ever been able to experience before the ThermiVa. So I just have to tell you that made me feel pretty happy. I said, tell your husband. I said, you're welcome. And let's see, another question. What's the best way? This is a great question. And I don't know where Nancy is from, but what is the best way to find a good doctor who's trained in this procedure in my area? So you can go on the ThermiVa site and say, find a practitioner or find a provider or search under your area. Interestingly enough, nationwide, the vast majority of the doctors who are offering this treatment are actually plastic surgeons or dermatologists. Why? Because they are in the know with all of the latest technology, and they have, 5 or 10 high-tech machines and devices in their office. So they're, believe it or not, the ones who are offering this to a lot of women. Now, interestingly, a lot of my patients and a lot of women I've spoken to said, well, they might love their dermatologist for their Botox or their filler. There's no way they would feel comfortable having their dermatologist insert any instrument in their vagina. And I love my dermatologist also, but I've got to agree. So you'll be able to see online when you search under your area and your region where the doctors are who perform this procedure and what their specialty is as well. And I would say, and this is just my personal medical opinion, I do think it's best to go to places where the person who's performing the procedure at least one of the 3 times is an MD. You know, I'm not sure why I can substantiate that opinion, but that's just my personal opinion. At least one of the 3 times I think is a good idea. Another question, is this webinar available again? I have so many friends that I want to hear it. Thank you. Well, we recorded it, and we can definitely send it to your friends. So if you email Anna at jenniferashtonmd.com, we will definitely send it to you. And, I really want to say to that point, I think it's really, really important that women are open with talking about this with their friends and our family. I think that we're pretty free with telling our girlfriends when we get Botox, if we get new boobs, if we get a breast lift. But all of a sudden, something like this becomes a little more taboo. And I mean, come on, it's 2016. I don't think it should be. And I actually think it's one of the biggest measures of female empowerment and one of the best things you can do for yourself. When you think about it, this isn't something that anyone else sees except the person that you want it to see, want to see it. And this is for you. So I think that in some ways, you could put this as important as your Botox or your highlights. So any more questions before we sign off for the evening? We've had so many really good questions. And, for a busy week as we get into the holiday season, I just want to thank everyone for tuning in. You can always email us at anna@jenniferashtonmd.com for any other questions about the procedure. But I definitely, and it's Anna is ANA at jenniferashtonmd.com. And also, I definitely encourage you guys all to go to realself.com and look at those testimonials, because I think that you'll find them pretty compelling. So thank you very much for signing in and joining, and have an amazing evening, and happy Thanksgiving to everyone. Good night.